Hey guys, how is everybody doing? I want to welcome you to Dr. Gilead Show. Today is February 2nd, 2017. On Dr. Gilead Show, we are transmitting on Facebook Live and WBGR Radio. You can call on 301-429 9247, 301-429-9247. Today we're going to talk about body dysmorphic disorders. Body dysmorphic disorders. Don't worry about it. I'm going to talk more about it. But as we do usually on this platform, we always encourage you to please don't make any diagnosis of yourself or based on what you hear on this platform, and do not diagnose somebody else based on what you hear on this platform. It's always good to get the right diagnosis from a trained professional so that you can be appropriately treated. Dr. Gilead Show, the producers and the host, is not responsible for what anyone does based on what they hear on this platform. All right, so welcome back. Today we're going to talk about body dysmorphic disorder. Body dysmorphic disorder. Body dysmorphic disorder is a mental illness. It's a diagnosis in which individuals cannot stop thinking about one or more perceived defects or flaws in the way they feel, their physical appearance. And that is, people look at themselves, they don't like a scar on their face or how they look, and they worry about it day in, day out. They just cannot stop worrying about it. And the things they worry about are things that people do not even notice, or these are minimal things. These are not really any major thing that people will worry about. So these are minor, slight things that nobody will really worry about. And what happens is people with body dysmorphic disorder will feel so ashamed, and they feel very anxious about these things. They can't just take their mind off it. And because of that, they avoid many social situations. They avoid people, they avoid places, and they may even stop going to work. And this will make them at some point perform things repeatedly, and the behaviors that they have are repetitive, the behaviors are intense, and they get obsessed about it. They worry about their appearance and their body image. So they end up doing things like constantly looking at the mirror, or looking at their body, checking out different parts of their body. This is how body dysmorphic disorder presents. Some people will have what we call excessive grooming or skin picking. I have a guy who he's always picking on his skin. He thinks there's. I said, man, what are you picking on your skin? He said, oh, there is some little thing. I said, no, there is really nothing there. And he keeps picking, he keeps rubbing, and he does all that. And what happens is the area of your body that you keep touching every minute gets darker. So the area becomes more deformed. There's a mark there, and that kind of spirals into things, and they feel more worried about their skin. And that is body dysmorphic disorder for you. Is not uncommon. People have it, and you see a lot of that among different races. Now, sometimes these people will spend hours and hours looking at those parts of the body or checking those areas of the body they're not happy about. They're checking it out. Sometimes they compare their appearance to that of others. They look at how other people look. They begin to compare themselves with other people. So this feeling will cause them significant distress, a lot of distress. It impairs their social life, it affects their occupation, and other important parts of their normal life and ability to function every day. They worry so much about it that it takes forever to get themselves out of the house. They worry so much about it, it bothers them so much that they cannot live a normal life anymore. That is body dysmorphic disorder. And we have people, we have artists, we have public figures who they've done different things to their body because of their concern of how they look or how some parts of their body looks. Now, what another thing they do, they may seek out unnecessary numerous cosmetic procedures to try to fix this perceived flaw. So they go from one doctor to another, one cosmetic surgeon to another, looking for ways to fix the situation. And it's unending. They get this surgery, they feel better for just a short while. And the feeling of inadequacy, the feeling of not looking good, the feeling of something on their face will reappear again, and they begin to look for another surgeon. And by the time they've gone to one or two surgeons, the surgeon will say, look, I can't do this anymore. They run to another surgeon. And people have had to go even out of state to go consult with someone else because all the surgeons in the area no longer want to do corrective surgery or cosmetic surgery on that part of the body. So the feeling is unending. It's something that happens and it keeps recurring. They try, they do the best they can to see if they can get rid of it, but it's so hard. Now the question is how often is this happening to people? Among U.S. adults, we have an average of 2.4% of all adults have body dysmorphic disorder. And in females, it's a little higher. 2.5% of females have this diagnosis, and 2.2% of males have this diagnosis. But when you look at the number of people who go to a dermatologist, that is the doctor that cares about your skin, it's said that about 9 to 15% of the patients that go to a dermatologist have body dysmorphic disorder. And among those that go to cosmetic surgeons, plastic surgeons, about 3 to 16% of them have some amount of body dysmorphic disorder. So it's not something that is uncommon. It's very common. It's among us. It's something that we need to be aware about so that we can notice it and take appropriate care before it destroys our life socially and economically. Body dysmorphic disorder usually starts usually before age 18. So it starts about age 13, 14. You see your child, they begin to focus and refocus on a particular part of their body. And I'm going to go through the parts of bodies that these people usually have problems with. So they focus on that. You want to go out with your child, and he spends or she spends hours on hours in front of the mirror trying to cover up the area that they feel something is wrong with, when in actuality there's really nothing there. Or if anything is there, is just a tiny thing that no one will even notice. So they spend unnecessary time times that is uncalled for, trying to fix this part of the body. So it usually starts about age 18 or before age 18, and it's chronic. It continues. It's also been shown that when it occurs before age 18, the people are likely to have more problems, and they have higher chances of committing suicide because it never ends. They are always on it. They are always worried about it. What are the risk factors? What are the things that can make body dysmorphic disorder happen? It's been shown that in people who were neglected as children, as young kids, or people who were abused, they are likely to end up having body dysmorphic disorder. But there is a genetic component to it. You have people who have first-degree relatives, family members who have obsessive compulsive disorder. If you remember, we talked about OCD in this platform. Is something we talked about, where people get fixated on doing the same thing over and over and over. They don't want to stop. They can't help themselves. Sometimes they know that it doesn't make sense, but they cannot help themselves. OCD. So people who have first-degree family members, first-degree relatives who have OCD are likely to propagate or have body dysmorphic disorder. So that's why, the more reason why we have to be very careful, especially when our children are young. We can't continue to tease them about certain things they don't like. That might push them to develop some amount of obsession or some feeling of body dysmorphic disorder. They won't like the way some part of their body looks. Is very traumatizing. Let's look at some of the symptoms. What are the presentations? How would the people feel? What would they report? What would you notice as a family member? What would you notice as the major problem that a family member who has a body dysmorphic disorder will present with? What would they have? So example of that is things like they are extremely preoccupied. They spend so much time with a perceived flaw that others cannot see or are very minor. So an example would be someone who has a little black head on their face, for example, and for them it's a big deal. They can't stop thinking about it. They can't stop touching it. They go from one doctor to another, and this is minor. Unless you come really close, you may not even notice it. But for them, it's a big deal. Now, number 2 symptom is they have a strong belief that they have a defect in their appearance that makes them look ugly, or makes their face or that part of the body to be deformed. So they're worried about it. They can't stop thinking about it. So that strong belief is there, and no matter what you tell them, look, man, there's nothing wrong with your face. You don't have anything. I just see a little dark spot on your face. They don't believe it because it is from the brain, the way their brain is wired. They keep thinking about it. They just cannot stop worrying about it. Now, another symptom is the belief that other people have taken or have special notice. Other people take special notice of what is on their face or what is on that part of the body. And people perceive it or look at it in a negative way, or people even make mockery of them. So when they pass by a group of people who are talking among themselves and they begin to laugh, the thought is, whoa, those people are talking about this part on this part of my body, or they're talking about my hair, or they're talking about how my eyes or my nose or my lips look. No, they have this strong negative belief about that part of their body, and they are unhappy, and there is nothing you can tell them that will stop them from thinking that way. So, because of this feeling, what do? They engage in behaviors aimed at fixing or hiding the perceived flaw on their face or on their body. So they go out of their way to make sure that that defect, that perceived defect, is covered. And what do? They go in front of the mirror, they check in front of the mirror, they try to pick and remove the spot. So you have people do a lot of skin picking, or put some makeups to cover it up. And in attempt to do that, they look they look so so made up, if I use that word. They cover up so much, they put so much makeup, people will look at them and say, oh, what is that? Then when people look at them because of the dressing to cover up, the hairstyle to cover up, or the makeup to cover up the tag or the skin spot, they become more worried that, whoa, the people are still noticing it. They spiral. It becomes a revolving door. When, as a matter of fact, people are looking at the makeup or the hairstyle you're using and not the thing you're trying to cover. So it's a very traumatizing experience. It's a very traumatizing feeling. So other things they do is they constantly compare their appearance to other people. So when they look at someone, if they're looking at some people who they think, whoa, there's so much hair on my face or on my body. So when they see somebody, they're looking at their skin, trying to compare if the person's skin is like theirs, or if they have the kind of hair they have on their skin, or their lips, as the case may be. Some people go out of their way to even ask people if the way they look is good. So it's a torture for them. It's a big, it's a pain. It's a lot of problem. So they always look for reassurance about their appearance from other people. I've had a patient who, what bothers her is she puts on some clothes and she leaves the home, and if the parents don't say, oh, you look good in that dress, or your hairstyle is good, she cries all day. She just cannot get over it that the parents will not compliment her dressing or how she looks. She's always asking people, do you think I'm beautiful? Do you have a problem with my teeth? So she has some amount of body dysmorphic disorder. She's never satisfied with the way she looks, and that is very common with these people. So what do? They seek frequent cosmetic procedures, and what happens? They do a cheek lift, or they do a lip thinning, or they thin their eyes or eyelashes, whatever they do, or repair of their nose, as the case may be. What happens? They feel good. But shortly after, they're back to the same feeling. It doesn't go away. It's a problem. So what happens? This causes them a lot of distress, and they avoid social situations. People who probably growing up, they like to go to family gatherings, and they go to parties or go to church or wherever they want to go. Now, once they begin to feel that way, they won't do it anymore. They hide in their closet because they're worried about some part of their body. So it affects their social life, their work. People have even dropped out of school. And I've had people come to me, hey, doctor, can you give me a letter so I can be homeschooled? Man, why do you want to be homeschooled? Oh, they're messing with me. I had a guy come to me. He said the other kids in school were talking about his teeth. Man, your teeth looks good. You have a nice set of teeth. So why do you worry? No, I don't want to go to school no more. So what did we do? We tried to get him into another school. He got into another school, the same problem. So it's not the students that are doing it, it's him. It's his feeling about his teeth, about his dental outlet. So that's body dysmorphic disorder. They avoid places, avoid people, and they have problems with their with friends and other people. So they obsess over the body parts. And some example of the body parts they worry about, for example, on the face. Some people don't like the way their nostrils look like. They don't like the shape of their nose. So what do? They go to cosmetic surgeries. They fix their nose. It looks different. They come back. They look on the mirror. Or they wake up from surgery. They say, "Oh no, that's not how I want it." So they end up repairing their nose, changing the shape, and at the end of the day, they will never be happy with the way their nose looks like. Some people is their complexion. They're dark or they're brown. They want to look lighter. It becomes a problem. Some people are wrinkles, simple wrinkles that they shouldn't worry about. It's not uncommon, or acne. So they have acne, and it worries them. The simple acne that there is really nothing there, and nobody worries about it. It's a problem for them. But before I go further, there's a question somebody just tweeted. It says, "Is body dysmorphic disorder a type of obsessive compulsive disorder?" Yeah, thank you, Mr. Brown. Yeah, body dysmorphic disorder is a type of obsession. It is grouped along with obsessive compulsive disorders, but it's just that they focus more on the looks on their body, and that's why it is specifically graded as a body dysmorphic disorder instead of an obsession. So they see something that is really nothing. A little thing gets exaggerated. So they have some form of obsession. And of course, they have some compulsion to get rid of it, either by touching it or by trying to cover it up or by getting surgeries. So yeah, it's a form of obsessive compulsive disorder. All right, so back to the parts of the body that people obsess about. Some people is their hair, the appearance of their hair. They look at their hair, "Oh, my hair is too dark," or it's too light. Some people look at thinning of their hair. For some people, some men, is baldness. Baldness is a genetic thing you inherit from the maternal area, from your mother's family. So it's genetic. If your grandfather, your maternal grandfather is bald-headed, there are high chances that the man will be bald-headed. It's genetic, and there's nothing you can do about it. And most people usually don't worry about it. They get a skin cut and they enjoy their life. But for some people, it is a big deal. They cannot exist with that bald head. So what do? They go looking for hair implant. They go from one hair surgeon to another, and they do the hair surgery, hair implant, and they're still not happy about it. They get wigs. They're not happy with the wigs, so they go from one place to another. Now, the other obsessions, the other parts of the body people could obsess about is the skin. Some people worry so much about the amount of hair on their skin. Some people, I had a patient who, she was so worried about the veins on her legs, and she's done vein surgery, and yet even the tiniest vein on her calf, she wanted it out. And the doctor says, "No, this is nothing. Don't worry about it." And that's how she got to me. because she was really obsessing about really nothing. How many people look at tiny veins on a lady's legs or the calf? Maybe some, but it's not anything that you can even notice unless you have her sitting next to you and you're really looking. So the veins there are not anything big. So people worry so much about these skin problems that or skin things that are really not much. Other things people worry about, for instance, some females, the breast size. There are women who they think their breasts are too small, and they initially, because they are young, they can't make decisions. They put some padding so their breasts can look bigger. As they grow older and they can afford it, they go to breast surgeons to do breast enlargement, and yet after the surgery they're still not happy. So they go back and forth. Sometimes the breast implants will burst open, and even after the surgery they come back, oh well, the two breasts don't look equal, or the nipple looks bent. When you're looking at the breast, there's really nothing wrong with it. So this is a kind of body dysmorphic disorder. They're never going to be satisfied with the look of their breast or the size of their breast. You see that it's going to be too big, or it's going to be too small, or it's going to be unequal, or the nipples don't look the same. They worry so much about it. And another form of body dysmorphic disorder, some men are really obsessed about the muscle size or the tone of their muscles. So what do? They're running from pillar to post. They're buying all types of vitamins, steroids to build up their muscles, exercising, and trying to tone their muscles to look better. Another type of body, another part of the body people worry about, or body part people worry about for men, is the genitalia. Some men get so obsessed about the size of their penis, and they go to any length to do either penile implants, penile expanders, they use the pump, they do all manner of things. At the end of the day, they end up having more problems, causing more damage to to the body part, and yet they're not happy about it. So whichever way, the presentation is about the same in males and in females, but males are more likely to be preoccupied with their genitals and muscle size, while females are more likely to be associated with eating disorders because they want to maintain a certain body size or a look. So they're preoccupied with their face, their hair, and the skin. So this is how body dysmorphic disorder presents. But at this point, we'll take a little break. Remember, we are on Dr. Gilead's show talking about body dysmorphic disorder. We shall take a break, and don't go away. We'll come back shortly.
Luxury of doing just that. If you want access to unpublished fares, reduced rates for travel agents, access to worldwide selection for family, group cruises, and all types of destination travel, then contact www.kingsport.vacation.com or call 240-393-7962. That's 240-393-7962. You deserve to travel like royalty. See you on your next vacation. How many
2-3 minutes.
Times are hard for many people in America today, but it can begin when you take action for yourself. Help is here. Log on to mymoneymyfreedom.com and get connected with a proven recession-proof company that has been helping people find financial freedom for nearly a decade. Whether you're looking to supplement or replace your income, they can help. They're a company with a AAA rating from the Better Business Bureau, and they do business in over 40 countries. Log on to mymoneymyfreedom.com. No selling soap, perfume, or makeup to your family and friends. No cold calling or knocking on doors for customers. They bring the customers right to you. The first step is yours. Take action now. Log on to mymoneymyfreedom.com. Their team of professionals are ready to help you succeed. Don't wait. Take action now. Start improving your financial future and put the passion back in your life. Log on to mymoneymyfreedom.com. That's mymoneymyfreedom.com. Take action now.
Do you love to fish? You want to fill up your cooler? Come fish with us. Real Brothers Enterprise.
All right, guys. Thank you. Welcome back to Dr. Gilead Show. We are on Facebook Live and on WBGR Radio. Today, you can call on 301-429-9247, 301-429-9247. We're talking about body dysmorphic disorder, a mental health condition where people spend a lot of time or are worried about body parts that really, there's really not much different from anyone else, but they are obsessed about it, they're worried about it, they're so distressed about it, and they go to any length to see how they can correct it. Body dysmorphic disorder, we've talked about the symptoms, we've also talked about the statistics, or the number of people who have it, the percentage, and all that. The parts of the body that people spend a lot of time focusing on. But let's look at the complications. When people have body dysmorphic disorder, what are the things that could happen? What are the other things that could lead to? And because they are always worried, distressed about this little body part, that throws them off balance. I see Miss Cole, Victoria Cole, Brown, and Chuck. Thank you for tuning in. Thank you. If you have any comment, you can send it to us. If you have a question, you can also ask. You can also call on 301-429-9247 on WBGR Radio. So what are the complications? The people who have body dysmorphic disorder end up having things like major depressive disorder, and that is well documented. Why? Because they are so worried, they are so sad about how their skin looks, about the shape of their lips, or about the hair, or anything you can think about. They're worried about it, they're preoccupied with it. They can't sleep, they feel sad, they isolate from people, and even some will hide in their rooms and use dark curtains to make the place dark so nobody can see their face. They become depressed to the extent that they could also have suicidal thoughts or suicidal behaviors. They begin to think of how to kill themselves because they can't take it anymore. They think everyone is watching them, they think everyone is looking at them, but really no one is really looking at them. No one notices even the problem they have. So that is one of the main problems. So they end up isolating themselves, thinking of suicide, and people have really attempted to kill themselves because they don't like the way they look. Other complications they could have is they could have anxiety. Anxiety disorders could develop from this. Anxiety disorders could develop from this. And why? They feel nervous. They think everyone is looking at them. They think people are talking about them. They think people are making comments about their looks. Or for a male who thinks his genitals are too little, he engages in inappropriate sexual encounter with a female And what does he do? He worries about how what people or what the girl is saying about him, and he will run away. He will have difficulty relating to another girl, and so he develops a lot of anxiety, and that could now lead to sexual disorders, because once he thinks about a girl or having sex, he can get an erection because he's worried and afraid about how the girl will think about his genitals. If the girl is going to feel that he is good enough, or is the girl going to talk about him that his penis is too little, when really he has a normal sized penis. That shouldn't be a problem. So they develop a lot of anxiety. Other health problems could also arise from this. From skin picking, they end up damaging their skin, or because they constantly touch a particular part of their skin, that place gets darker, because where you touch all the time will leave a dark mark on it. Then that will spiral and worsen the feelings they have. Others could, because they go to go through multiple surgical procedures, they end up getting deformed face. They don't like the way they look. They get the surgery. They go to the mirror. They go in front of the mirror. They think, oh, my cheekbone is too high. They think they're a piece of artwork. So they end up going back and forth, back and forth. They put on some prosthesis in their nostrils to make it stand erect, or to stand in a particular way they want it. At the end of the day, they have a problem. Or they do so much surgery on their lips that the lips can no longer close. So they end up having a funny looking set of lips. So that is more distressing to them. When actually, if they had not indulged in such cosmetic surgeries, they would have really looked better. But because they will never be happy about how certain parts of their body look, they will continue to chase the cosmetic surgeons. Now, the other things that complications that people could have is from, they could have eating disorders because they don't like the way their body looks. They think their abdomen is too big, or they think that their behind is too big, or they think their breasts are too big. So they indulge in things that will make them lose weight. So they end up having eating disorders. And when you have eating disorders, severe eating disorders, what happens? They lose so much weight, they have difficulty with their whole health, their immunity drops, they end up having electrolyte imbalance, they become so thin, so cachectic. I don't know if you've seen, and when we talked about eating disorders, we showed you some of those pictures of people with anorexia nervosa. They look so skinny, so thin, and they exercise day in and day out, and yet they're still not eating. Some will eat and they will make themselves throw up. Can you imagine someone, you eat, have a good meal, and they put their finger in their mouth and make themselves throw up? That is bulimia. At the end of the day, they may lose weight or even lose too much weight. They have electrolyte imbalance. The females will have no menstrual cycle anymore because the whole body system has changed because they've lost too much weight. Their hair becomes so thin and they look pale. Some will be complicated by substance abuse. Because they don't like the way they feel, they end up using drugs. They want to use drugs to block their emotions. Some will drink so much alcohol, it really destroys their liver or their brain. Some will indulge in cocaine or other stimulants, PCP, and you know how cocaine and PCP destroys people's lives. It could cause, they could have a stroke, they could have a heart attack. They indulge in behaviors that could get them killed. When people are high, They can't think right. So these are some of the complications that can occur when people have body dysmorphic disorder. So the question is this: when should someone really seek help? When should a family member go get help? Because there's nothing wrong in thinking that you have a spot on your face that needs to be removed. There's nothing wrong in getting some makeup to make yourself look a little more presentable. But now, when people have body dysmorphic disorder, they have shame, they feel embarrassed, and they won't even get out of the house. So, I want to say this. If you are listening to this presentation today, and you are in that situation where you are so ashamed, you feel embarrassed about some little spot on your face or how your lips or your nose look, I need you to get out there, go get some help. If you are worried about your body size and all that, go out there and get some help. The problem is when people feel this way, they isolate. They don't want to go out because they think everyone is going to be looking at that particular part of the body, and they are so ashamed, they feel embarrassed, so they stay home. And it does not go away. If not treated, it could get worse and lead to all the complications I just talked about. So when people are going through this situation, if you are a family member or you are, or even yourself, you know that, man, I think this doesn't make sense. I should be out there. I should be partying. I should go out to get a job. I should be mixing up with people. But you're worried about this little thing that is on your face or a particular part of your body. You're worried about it. Get out there. Go get help. And sometimes you feel, oh, my breasts are too little or my breasts are too big. That is not a problem. Go out there and enjoy your life. And if you're so worried because you can't do things that people are doing, you can step out there and go to a trained doctor, go to a trained personnel, and get the help that you need. So family members should look out for this. Get help for your children, get help for your spouse, get help for your partner, your friend. So once they are in this situation, they should go get help before it gets too late. Now, what are the treatments available out there? There are two major types of treatments. You can treat them with medications, and also you can treat them with psychotherapy. Now, it's been shown that people with body dysmorphic disorder can get some help when they are treated with medications that increase the chemical. Remember, we talked about the chemical serotonin. Serotonin is one of the neurotransmitters in our brains, in everybody's brain. But in some people, if it gets too low, people have some symptoms of depression, obsessions, body dysmorphic disorders. So when people come to me as a physician, I use SSRIs. They are called serotonin specific reuptake inhibitors. Don't worry about the name. But these are medications like Zoloft, Prozac, Paxil, Celexa or Lexapro, or even Luvox, which is fluvoxamine. That's the medication we really use for OCD. These medications have been shown to help a lot of people stay well when they have a body dysmorphic disorder. So these medications increase your serotonin level, and once the serotonin level comes back to normal, people feel better. So remember, for body dysmorphic disorder, SSRIs are used to treat that. Now, what else do we do? When I see these people and I put them on medications, I still send them to a psychologist or a therapist who will now do psychotherapy with them. And the specific psychotherapy that has been shown to be helpful for people with body dysmorphic disorder is cognitive behavioral therapy. What happens in body dysmorphic disorder? So people have negative thoughts about their look, negative thoughts about how a certain part of their body is. They look at it differently. They have exaggerated feeling of how that body part is, when really it's not anything major. It's not anything to worry about. But they have a negative thought about that part of the body. So we send them to a psychotherapist who will do cognitive behavioral therapy. Excuse me. So in cognitive behavioral therapy, what happens? The therapist helps them become aware of their thoughts. For example, someone has a thought that the shape of her lips, or her lips are too big, or his lips are too big. So the question is, there are 1,000,001 people who have lips that are the same size as yours, or even bigger. Or some people have a little spot on their face that really no one even notices. But they develop this negative thought about that spot on their face. They think that, well, with this spot, no man is going to like me. With this spot on my face, I can't get people wanting to relate with me. So that is a negative thought. Because of that negative thought, they have all those symptoms we talked about. Now, cognitive behavioral therapy helps them to recognize the negative thoughts. So they become aware of it, and they recognize that those thoughts are not right. In cognitive behavioral therapy, the therapist will teach the patient on how to override these thoughts. For example, you have a thought that your penis is too little. So every single woman you meet is not going to be satisfied, when actually you have a normal sized penis. So what the therapist will do is to spend time teaching you, one, what is the average size of a male's penis? And you check out yours. It's the same size. It helps you to recognize that you are like everyone else. You are not really little as you think. Or for some people, they think that their hair is so thin and doesn't look good. So in CBT, you look at the average hair structure of any human being, depending on your race, curly hair, straight hair. By the time the therapist works with you, going through that, you realize that, whoa, okay, my hair is about the same like anyone else. So people begin to make those changes. Of course, it's going to take time to change that thought pattern, but it's doable. With help from medication and the therapist, you will notice that you begin to get better. It will take some time because there is possibly a genetic component to it. It takes time to override those thoughts. Hey, Mr. Henderson, I see you joined. Thank you for joining. We are on WBGR Radio and on Facebook Live. You can call on 301-429-9247 to make a contribution or ask a question. We're discussing body dysmorphic disorder today. Now, we're talking about treatment and we're talking about psychotherapy and specifically cognitive behavioral therapy. So, these patients, the therapist will teach them to make attempts to change their perception about themselves. So some of these people have a perception that they're no good. Oh, because I'm a black person, I don't look beautiful. Or because my hair is curly, it's not good. I like to have a straight hair, a white straight hair. But you're not white, so you should be satisfied with the type of hair that you have. So cognitive behavioral therapy will help the individual reorient their thoughts, change the way they think about themselves, to change their perception of themselves. So if you're watching this today, I really need you to go back, sit down, look at the things you worry about, compare what other people look like. If you're worried about some particular thing, there are millions of people who have the same body structure as you. So don't worry about it. If you think someone or no man or no woman is going to like you because of that, don't worry about it. That may be the thing that a guy will really like about you. Or that may be the thing that a female will really like about you. So don't worry about it. Don't stress about it. Don't force about it. Just go live your normal life. You need to start thinking better about yourself. You need to start having a better perception about your body. What you're worried about is what some people will really like. So don't worry about it. Now, cognitive behavioral therapy also teaches the individual ways to handle the stress, ways to handle the perception and the rituals that they do. For example, a person who has a spot on their face, and the tendency is to continue to touch it every time, continue to touch it. Cognitive behavioral therapy will help teach you not to put your hands to it anymore. That way, you don't leave a darker spot on that particular part of your body because you're touching it all the time. Some people may look at their skin and say, oh, my skin is too dry, so they put lotion every minute. Every minute they put lotion on their skin. These are rituals that you think could help you overcome the part of the body or the feelings you have about your body. So cognitive behavioral therapy will help you to manage not to do or indulge in those rituals. At the end of the day, you begin to do better. Now, so we all need, if you have any of these symptoms, you need some help. Go get it. Go to the right doctor. Go to the doctors, and you can tell your primary care. Your primary care doctor will look for the appropriate, well-trained physician or treatment personnel and refer you to them. And there are groups of people who have body dysmorphic disorder, and people help each other talk about it. And people who have been able to overcome their negative feelings about themselves, their negative perception about how they look, will help you go through it. And we know about some of our pop stars who have indulged in multiple cosmetic surgeries, that they begin to feel so bad about how they look. At the end of the day, they wish they had looked different. Recently, I saw in one of the magazines, they were showing about how a lady, she used to be a star, how she looks at this time. And there was also a picture of how she would have looked if she did not go through those body-changing cosmetic surgeries. As a matter of fact, she would have looked much beautiful, much better without those surgeries if she had not done it. So what am I saying? Be satisfied with the way you look. Be comfortable in your body. Be comfortable with your body structures. And if it is very obvious, that some cosmetic surgery needs to be done or some corrective surgery needs to be done, well, you can do it, but do not continue to run from one cosmetic surgeon to another or from one dermatologist to another. Because at the end of the day, what that does is it causes you more problem, and you end up being more dissatisfied. People have had a bariatric surgery because they want to look thinner. And what happens? They end up becoming too thin, a lot of complications. They wish they did not do it. So it becomes a bigger problem. So let's look at the effects of body dysmorphic disorder on the individual that has this disorder. What happens? They end up avoiding, probably dropping out of school because they're so ashamed of their body. They avoid people. So they end up not being in any relationship because they don't like the way they look. And the belief is that people will not like the way they look. So they don't want to get into relationships. And even when someone makes a compliment about, oh, your lips look good, those lips look beautiful, they read it negatively. They think, oh, they're making mockery of me. That is to make a mockery of my lips. No, the person is really giving you a compliment. So we have to really accept how we look. What you going to do about your height? You're too short or you're too tall. What you going to do? You cannot do anything. Cosmetic surgery cannot change that. So you accept the way you are and be happy and enjoy yourself. There are people who will really love you for what you look like or for how you look. So these people, because of the way they feel about themselves, the body dysmorphic disorder, they avoid people, they avoid social gatherings. At the end of the day, they drop out of school, they may stop going to work, and what happens? They lose their income. So a person who was doing well, earning good money, living a normal life, will drop out of work, stop going to work, and isolate in his house. What happens? They lose their housing, they become homeless. The problem spirals into a bigger problem because now they're homeless, they can't pay for their car, or they can't pay a car note, or they can't fix their car. So they're homeless, they don't have a car, they don't have a job. What happens? They become so disillusioned, they become hopeless and worthless, and what happens? They kill themselves, they commit suicide. That is one thing that the individual needs to avoid. So this is the effect of body dysmorphic disorder on the individual. How does it affect the family? A family where a person or a child or a what or a parent, they stop going to school. The parents are worried. They want to have them homeschooled, which is a good idea. He gets homeschooled. He can take online classes in college now. He can get a job. He has to go out to interview for the job even if he wants to work from home. So it's a problem. So the family, it causes a lot of conflict. And also the time spent in front of the mirror, looking at themselves, trying to make up, trying to cover up this particular part of the body that they're worried about, is a problem. You also look at the money wasted on cosmetic surgeries, on seeing dermatologists for something that is really, really nothing, or buying things to cover up these perceived defects. Also to the society, to the government, to the insurance company, there is lost productivity at place of work. Insurance money lost on these unnecessary cares. But these things are some of the complications. There's a question. It says, is the rate on the rise due to social media and TV, or has it stayed the same? That's a good question. With social media and a lot of lifestyle changes, I would think that people are becoming more conscious of their bodies and probably could indulge more in cosmetic surgeries, dermatologists, and so they can look exactly how they want to look. Is not uncommon. I mean, I don't have the statistic to say it's on the rise or body dysmorphic disorder is on the rise, but I would think that with social media and how even people relate to others, it might be on the rise, or people may have more feelings or more negative feelings about how they look. And there's another question Chuck sends, or ran out of time. It says, is this disorder also applicable to people who always compare themselves to others and feel inadequate if they are not measuring up? So, the people with body dysmorphic disorder always compare themselves, always compare their looks, how they appear with other people. They always do that. But it's not generally a feeling, but they always compare themselves, and that could worsen the way they feel. Now, I want to say that families should encourage them to get help, and importantly, do not make fun or tease your family members because of how they look. That will make it worse. Don't tease your girlfriend or tease your husband of some things, because that will make them withdraw more. Show them love. It doesn't matter how they look. It doesn't matter some little thing on their body that is not looking like other people. Just show them love. Don't talk about it. The more you talk about it, the more you tease them about it, the more they withdraw. And I want to advise young people, stop teasing your fellow students in school about little things that will drive them to have more symptoms like body dysmorphic disorder. Even though they may be genetically predisposed to it, but if nobody really talks about it or teases them, they don't feel too much bad about it. So let us be each other's keeper. Let's be our brothers and sisters' keeper by not teasing them or making fun of things they have no control over. We've run out of time. Thank you, everybody, for tuning in. Today on Dr. Gilead's show, we talked about body dysmorphic disorder, and I want to say that is not an uncommon illness. 2.5% in, if you compare the population of 350 million, that is a lot. It's something that could happen anywhere you go. So please, if you notice anyone who has this illness, get them help, advise them, don't tease them, show them love, and they will appreciate it more. Thank you very much for tuning in today on Dr. Gilead's show, on Facebook Live and on WBGR Radio. We'll come back, we'll be back on the same station, same time next week, Thursday at 1 p.m. Eastern Standard Time. Thank you very much for tuning in, and have a nice day. We'll see you again next week. Bye-bye.